The Gauteng is recording more daily COVID-19 infections now than it did in the first wave. Premier David Makhura says the number of hospital admissions increased quickly after the December holidays and that young people are at risk. He was briefing the media earlier on the coronavirus stats in the province. Masego Rahlaga following that story for us. She joins us live. So let's start with what the provincial government will do about contracts of healthcare workers that actually end on the 31st of March.
Well, Shahan, the Premier is saying that that is one of their main concerns, to make sure that they have enough healthcare workers to be able to give service to the people who need help at our hospitals. Looking at the number of people who are in our hospitals because of coronavirus and other issues, coronavirus alone, Shahan, is over 4,000 people. So the Premier is saying that they will look at different budgets. For instance, I did ask him a question about whether or not perhaps the health department has a certain budget or certain money that is allocated for trauma units in hospitals. And you'll remember that picture, the President alluding to that picture as well last night, with the Chris Hani Baragwanath Hospital tweeting a picture of an empty emergency ward on the 31st of December 2020. That was New Year's Eve. The Chris Hani Baragwanath Hospital saying that it was the first time that they had no trauma patients since the hospital was actually established. So the Premier answering me along with the MEC of Health in Gauteng, saying that there's no budget really allocated for that specifically, but because they didn't have to use a lot of money due to trauma at hospitals, they'll have to redirect some of that money to other issues relating to the fight against COVID-19. One of those, Shahan, being those workers whose contracts are supposed to end on the 31st of March, their contracts being extended and looking at getting even more workers on, and of course more beds at hospitals such as the one in Bronkhorstspruit. Here is the Premier.
The staffing that we had during the first wave, we took over more than 400 health professionals. We also got additional nurses from the National Health Department. We want to retain them. We had gotten these health professionals on the basis that the coronavirus pandemic is going to change in 2021, so they were on contract up to the 31st of March. We have now decided as the Gauteng Command Council that the provincial government, that's the Executive Council, must help us to find the money to retain these health workers. This includes doctors and allied health professionals. It includes the nurses. We want to retain them as we deal with this difficult period. So the one clear question about what we are doing to ensure that the capacity is there. At the peak, we didn't use all the capacity. At the peak of the first wave, we didn't use all the capacity. We're going to need, from a staffing point of view, we're also increasing access to oxygen. There's a team led by the acting HOD, which has also been engaging with those who provide oxygen, medical oxygen.
And the number of people in our hospitals in the province, how's that looking?
Well, Shahan, I think that's one point that startled a lot of people who are listening to the Premier speak today. He said that about 50,000 infections, active infections, are actually here in Gauteng. But he also said that we are actually not on our second wave yet here in the province, because people are still making their way back. As you know, schools have not reopened yet. It's still 2 weeks to that. So he's expecting, him and the Provincial Command Council are expecting more people to make their way to the province. So we haven't experienced our highest peak yet. And if you look at it, he said that when we were at our highest number during the first wave, it was at about 6,500 new infections at that time. Right now, we've actually shown an increase to 6,900, over 6,900 new infections at this second wave. But he also, like I said earlier, says that Gauteng is actually only starting with the second wave. But in terms of the people admitted to the hospital, Shahan, about 4,128 patients admitted in our public and private hospitals. About 220 of those in our intensive care units. 220 of those patients are are on ventilators, and a little less than that are those who have oxygen masks on. So it's quite a dire situation. He does say that they are adding hospitals, they are keeping Nasrec open. As you remember, there was about 1,000 beds at that Nasrec facility. They took it down to 500, and he says they'll keep it at that until they are sure that we have surpassed the second wave.
There was a period, essentially at the peak of the first wave, where the number of hospital admissions, particularly in public hospitals, were highest at over 3,106. When we combine both private and public at that time, there was a period at the highest point of the first wave. That means at the peak of it. We had more than 7,000 hospital admissions. And here, we're talking about both in the private and in the public sector. But what we are giving you today is just an indication of, with public sector numbers, our numbers have been, just at the beginning of January, we were as low as 700 hospital admissions. In the public sector, those numbers have doubled to over 2,400 as we speak. Over the last 7 days, the numbers have, in fact, they've tripled to over 2,700. If you ask the question, what's happening in the private health sector, I'm going to show you a slide that shows that the private health is also not coping. We are coordinating, we are working together. In a number of instances, we have also admitted in the public sector some of the patients from the private sector. But we are reaching that level of seeing significant increase in hospital admissions. We are not yet at the level where all our hospitals are full, but the last 7 days has given us a sense that the numbers are increasing quite rapidly.